We are.
Since we're live, we wanted to say hello to everyone. We are trying something new today. We are
Yes.
streaming live on YouTube and Facebook. So we just wanted to say hello to everyone. This is MD plus BBM. I'm one of your hosts, Dr. Priscilla.
And I'm Dr. Kim.
So welcome, welcome, welcome today. We have a fun and fabulous and fantastic episode. We will be talking about dental health today. What an awesome day to talk about that. But I mean, because you have to eat right, your pet has to eat. And so if you don't have good, if your gums aren't healthy and your teeth aren't healthy, then you can't really eat. And we're also going to talk about how that affects other areas of the body too. So before we get into that though, we want to talk a little bit about, we always do current events.
Yeah.
And Dr. Kim, do you want to go over what one of the most recent current events we have happened?
So unfortunately, Supreme Court Justice Ruth Bader Ginsburg recently passed away, and she was the first woman and first Jewish woman to lay in the Capitol of the United States, and she passed away of pancreatic cancer. We also lost this year John Lewis, who was a civil rights icon and important person for that movement. He also passed away from pancreatic cancer. And most people, if you talk to folks, people know those who have succumbed to that disease. And so we wanted to make you guys aware of pancreatic cancer and the importance of getting screened. The unfortunate thing about pancreatic cancer is that it's kind of silent. So if you start to notice any feeling full faster, if you notice that your appetite has changed, if you notice unexplained weight loss. So most of us are trying to lose weight. But if you notice unexplained weight loss, you need to talk to your doctor and make sure that you are getting screened for it. It is something that can happen at any stage in life, but it is most prominent in those in their 40s and 50s. But we just want to make you guys aware, and because that's something that just recently occurred, we wanted to make you guys aware of that, and that we are praying for her family and for John Lewis's family as well.
Yes. Yes. Thank you so much for going over that. And I actually had an aunt to die on my dad's side. One of my aunts died of pancreatic cancer, and it is definitely commonly known as kind of a silent killer. Because usually when people find it, it generally can be too late to combat. So we definitely want to urge you to consider all the things that Dr. Kim said. On that note, we will also segue as it pertains to the Supreme Court. We're getting into election season as far as national elections. And while we don't tell you on this show who you should vote for, we encourage voter education, especially if you are a citizen of the United States. And no matter where you are around the world, always educate yourself on the issues and what matters to you and to your family. And with that said, we want you to go online if you haven't already to either register to vote if you meet the criteria in this country, and or confirm your registration. Make sure that your name is still
on the ballot.
Not
on the ballot, but on the roll.
Yes.
Yeah.
Yes, I go and do that leading up to major elections. I always make sure that my name is still on the rolls and that everything is okay. So we want to encourage that. We will actually have an announcement that we are likely going to be taking a break. We are taking a break after this show. We're going to go on a little hiatus. We have a couple of speaking engagements, and we just want to make sure that we put together another round of good shows for you. So we're going to take some time to do that. And although we're sad to leave for a little while, we will not be gone for forever. We will come back with little short shows for you and information on our Instagram pages. So remember to follow us at Dr. Kim _neurodoc and follow me at Dr. Pet Nugget. With that said, Oh,
Yep.
go ahead, Dr.
I'm
Kim.
saying follow us both at MD plus DVM. We're
Yes.
both on Instagram. We're on Facebook and Twitter under that handle.
Yes, yes, absolutely. And with that said, we want to go ahead and introduce our wonderful special guest. Dr. Kim, you want to take it away?
Sure. So our first guest is a awesome woman. Her name is Dr. Candace Wakefield Tita. She is a dear friend of mine from back in the day at University of Missouri. She got her undergraduate degree from the University of Missouri in Columbia, Mizzou. Even though we lost to Alabama, that's okay. So
Roll
she went
Tide.
to Mizzou.
Sorry. We don't get political.
Mizzou for undergrad and got her degree in biology, then went on to Southern Illinois University and got a doctorate in dental medicine, and then went on to Howard, HU, and got her additional training in pediatric dentistry, where she was the chief resident there. And then now she is a proud business owner of the Children's Zone in St. Louis, Missouri. She is a proud mom of one, rambunctious young man and wife. And she's just an all-around great person. I'm blessed to know her, and we are blessed to have her on the show.
Wonderful, wonderful. And I'm so excited about Dr. Wakefield. And on the DVM side, the vet med side, we have Dr. Lauren Celestin. And I'm going to read you her bio. Dr. Celestin is living her childhood dream as a small animal veterinarian. There are a few greater pleasures for her than getting other humans excited about the things that excite her. Right now, that's all things veterinary dentistry. Intrigued by the idea of animal dentistry and its profound impact on the quality of animal lives, Dr. Celestin is motivated to learn more about the specialty. She spent the last 4 years learning and observing specialized dental procedures and advanced oral surgery with board-certified veterinary dentists across the country. And that's really cool. You don't hear about that every day in vet med.
No.
Dr. Celestin actually grew up in New Orleans and also attended Howard University, the Mecca, the Hilltop, and majored in philosophy and anthropology. She earned her doctor of veterinary medicine degree at Tuskegee University in Tuskegee, Alabama, and graduated at the top of her class, magna cum laude. We always applaud academic achievement here. So off duty, Dr. Celestin is involved in a lot of different organizations. She loves fitness. She wants to recruit you for her boxing class. And then she is happiest when her Rhodesian Ridgeback, Captain Pickles, decides to spend time with her. So we're going to welcome them on. We're going to bring on Dr. Candace Wakefield and Dr. Lauren Celestin.
Hey.
Hey, everyone.
All right. So glad you guys are here. So let's get started. When you think about oral health and teeth, for humans and for pets, why is it important that we care about our teeth?
Well, I can start. Basically, we need teeth. We need teeth to talk. We need teeth to eat. We need teeth to smile. It's just form and function, primarily is what we're talking about here. So without having your teeth in the right, proper place and condition, healthy condition, it's very difficult to do those basic form and function things, such as eating, chewing, talking, laughing, smiling. So it's just the reason why we should care is because that you need those teeth to be able to function. Just try to do any of those things without teeth. You've seen older people without teeth, how they may look sunken in. Very difficult to eat and chew and smile and talk. So it's just important for us to be able to do the things that we like to do well. When you have teeth, it makes it all better.
That's right.
Which actually is a little bit different on the animal side. Is we jokingly in our world say teeth are a luxury for our pets because they don't have to go out and take down their dinner. Well, I hope they don't. We're providing their food for them. So for our patients, it's really a total health thing because the health of your mouth can affect the rest of the health of your body, just like with humans. So we get patients and people all the time who, well, my dog's got such stinky breath, and I really wish we could get a little closer. Oral health care and staying on top of that is going to be the best way for us for you to get closer to your pet and for them to be healthier systemically.
Can we talk about that for a minute? Because I know it's on the human side, of course, we talk about social norms and, if a person's breath is not as fresh, I mean, that is something that people may bring up. You're working all day, you're talking, or, just in a lot of different environments. On the vet med side, people bring that up quite common with pets. And Dr. Celestin, can you just follow up on that a little bit?
Absolutely.
I just want to get this out there for our viewers with pets to learn about why their pet's breath may smell, whether it's puppy breath, which everybody thinks smells wonderful, but sometimes they eat poop. And then, about older dogs. Can you cover things like that?
So it's a common myth, really. We've heard all our lives, oh my gosh, it's just doggy breath. Oh, it's okay. It's supposed to smell like that. And the truth of the matter is no one, human or animal, should have bad breath. In our pets, it is also a sign that something's going on in there and we need to check it out. For the pet side, a lot of people get consumed with the fact that, oh, the teeth look nice. Oh, the teeth are so white and pearly, but the breath still stinks. Because, and Dr. Wakefield, you can certainly attest to this, that most of the problems are happening at and below the gum line, which we can't see with the naked eye. You have to have a specialist or someone get down in there, and we've got to do dental x-rays. So all of the things that we do on a monthly, by-year, annual, and maybe sooner than that, chance with our teeth, with our dentist, should be happening with your pet as well. So those intraoral radiographs are absolutely crucial. We have pets all the time that we see beautiful, shiny, pearly teeth. And then once we take those x-rays, periodontal disease is just crawling up in there and is taking over. And that's why your pet is having that stinky breath. You're smelling the bacteria and all of those things that you can't see living below the gum line.
I actually get that a lot in the office too. Parents will ask me, why does my 3-year-old breath smell so badly? And like she was mentioning, it's beyond that. Sometimes you can also have post-nasal drip from your sinuses and allergies, people that have allergies, and then also from the belly, GERD, or gastroesophageal reflux disease, can also play a role in how you can have bad breath. It goes beyond just your teeth and your gums, but people also don't brush their tongue either. So your tongue, basically, it has little tiny hairs on it, and if you don't brush your tongue, bacteria can accumulate in there and have bad breath. And you can also have a broken or chipped tooth that has accumulated food, bacteria has developed, and can also attribute to bad breath. But we do want to dig deeper, and a lot of times that's usually the cause is an allergy or some other thing happening in the body.
Have you all ever, because you said your body, so when you think about human bodies and pet bodies, how is the connection between oral care and their physical body, like other diseases like diabetes, heart disease? What's that connection that you all can see in patients?
Well, I can speak to that a little bit. Basically, your mouth, we like to think of it as a window for the rest of your body. So some things that, as Dr. Celestin said, some things that are taking place in your body show up in the mouth. I'll give you an example. Someone who has diabetes, for example, they tend to be kind of sick. They can have an increased risk of periodontal disease, and their periodontal disease state kind of goes hand in hand with their oral hygiene. So if you have someone who is compromised in the way of diabetes, and they have a hard time because of the inflammatory response that's happening as a result of the bacteria that is in the body, that immune response likes to show up as a defense mechanism in terms of breaking down some things. And when that happens, it's hard for a diabetic to be able to control their blood sugar. And then they have poor wound healing, things of that nature, dry mouth. They have at risk in general to lots of other diseases. It's that same thing about anywhere the blood can go, the bacteria can travel. So if, in a normal situation, no, you don't have bacteria enter into your bloodstream. But if someone has gum disease, and what I mean by gum disease is, an infection or bacterial inflammation that affects not only the teeth, but the gums and the supporting tissues around the teeth. And if you have advanced or moderate gum disease, that essentially is an entry point by which the bacteria can go to other parts of your body. So in the brain, there have been association with Alzheimer's. In terms of, again, inflammation is basically how all this is taking place, as well as the heart, narrowing of the coronary arteries and thickening of the arterial walls can lead to heart attack and stroke. We also have an instance where if you have a parent, a mom who's pregnant that has periodontal disease, they can have a child that is delivered early, preterm, low birth weight babies is a thing because they have gum disease, and the bacteria basically create toxins into the placenta and can cause preterm labor.
Wow.
As well as growth and development issues.
That's serious.
Yeah,
It's true.
Mm-hmm.
It is.
Well,
They don't know that, but it just kind of goes hand in hand. You really can't be healthy if your mouth is unhealthy.
why do you think people, and when it comes to themselves and pets, though, why do you think that they don't? Why don't they understand? Why don't we understand the importance of teeth? What do you think is because what you guys have said, you talk about bacteria and the buildup and all of the parts of the body that it can affect. And Dr. Celestin, we did have a viewer on Facebook asking about how often dogs' teeth should be cleaned. So we want to answer that. But I really I also want to hear, why don't people take the mouth so serious? Like, why don't they take it as serious as they should with themselves and their pets?
Mm-hmm. Well, I would say what I get on the animal side is people take, and I don't know if this is how they perceive their own oral health, but they perceive teeth as more of a cosmetic issue. So that translated into pets is, well, I mean, they look shiny, they look white. I mean, okay, so why would I have to go any further than that? And then there's the common, just everyone has a different standard of where they put their pet, as far as family member, working animal, or just an animal. And those that are family members, tend to get a little bit more specialized care, if you will. Those that are working animals tend to get more focused and specialized care in the sense that they have to use their mouths to do their job. So the animals that you see at the airport that are testing, looking for drugs, the animals that are taking down criminals, those animals, that's how they live. That's what they do. So everyone has a different view of how they perceive teeth in their pets. I would say the majority of the pet population seems to be just really they don't know. And once they know, and once we explain to them all of the reasons why this could be at the crux of your pet's healthcare, they tend to be a bit more amendable. Now, it is a little different because our patients have to go under general anesthesia. There's a lot more involved in just, going to the dentist and saying, hey, it's time for my cleaning and checkup. So there's a little bit more involved that we have to get people more comfortable and on board with as far as taking care of their pets' teeth.
And if I can say so, on the human side, we are unique. Humans are just special. We are afraid of the dentist. A lot of people are just afraid to go. So they'll try to maintain as best they can at home, giving old home remedies. I've heard lots of stories about how they think they're taking good care of their teeth, but they're actually causing damage to themselves. So when people are afraid to go to the dentist because of negative experiences that they've had in the past, or that have been passed down from generation to generation about all the bad things that are going to happen when they go, then they don't want to go. And then aside from that, they don't always want to invest in the tools that they need to invest in to take care of themselves. Or it's just not a priority. As parents, sometimes we put ourselves last. We take care of everyone else before we take care of ourselves. We invest more in our children than we do in our own selves. And so it's just something that we need to overcome and spend more time doing, because the more education that's out there about why oral health is important, the more people will learn and know more about it.
Those are all great points. And I just would like for you all to, I know we want to get into some deeper topics too, but as far as dental cleaning for people and pets, how often should these occur, and why should people get them, their pets, their children, why should they get these cleanings at the intervals that are recommended?
Well, for children or for adults, we say every 6 months that's the recommendation by the American Academy of Pediatric Dentistry, as well as the American Dental Association. Now, that's not to say you can't get your teeth cleaned or get an evaluation more than every 6 months. Some people that have periodontal disease, which is an active disease state, it's necessary for them to go to the dentist every 3 months. Some conditions you may follow up on every month It just depends on the state. But the the overarching rule of thumb, I would say, would be every 6 months. And I work with children exclusively, and in children, the enamel on the teeth is much thinner, and so when a cavity starts, it can rapidly spread through the layers of the tooth a lot faster than it would in an adult tooth. I do actually have a model. So, for example, it looks like a tooth, but there's the nerve in the middle of every tooth. So when the decay process begins, we're talking about how fast it can reach from the outside to the inside before it causes a problem. So if you only go to the dentist every other year, then you're going to miss some issues that you could have prevented. So it's always best to prevent instead of always having to chase the problem after the fact.
Absolutely. Same on this side. If our aim is to prevent. Unfortunately, where we are right now with veterinary dentistry is we aren't exactly in a preventative situation just yet because we haven't gotten everyone on board. I want to put this scenario in everyone's head to just kind of put the emphasis on why it's important that we get our pets in. But as Dr. Wakefield was saying, generally every 2 months, most of us go into the dentist, and we've been doing that hopefully since we've been children. With my patients, usually we aren't seeing them until they're 7, sometimes 15 years old, in an animal that is not brushing its teeth. So if you put that into human equation, I'm now seeing a patient that's probably the equivalent of an 80-year-old man or woman who has never brushed their teeth before in their entire life. and now
that perspective scares me.
Exactly. That now also probably has other comorbidities or other issues like diabetes or other adrenal, endocrine diseases, other things that complicate the anesthesia that we have to use for our patients. So just think about that walking into to your office, or you having a conversation with that 80, 90-year-old person that's never had their teeth brushed or seen the dentist before. So we recommend every year, annually, your pet should be seeing under anesthesia, getting complete intraoral radiographs, so that's x-rays of the entire mouth, and cleaning. Because like Dr. Wakefield was saying, we missed so many things by not doing that checkup yearly. And our patients, our pets, they're never going to tell you it hurts. They're never going to stop eating. They're never going to stop taking that cookie from you. They're not going to stop wagging their tail. And if they are not doing those things anymore, then we've gotten ourselves into a way deeper situation that may now be beyond the mouth.
True. Yeah, that's very true. Again, dealing with children, as she mentioned, and being under general anesthesia, sometimes we have to treat children under general anesthesia, and some adults even have to get treated that way as well. And some people actually prefer it that way because, as she said, sometimes we may not see someone until several years have gone by, and that is not the time that you want to just have to spend. It's just difficult. It's difficult on everyone. So it's easier to just prevent problems than it is to wait until the last minute and try to take care of everything at once.
We have a viewer question from our YouTube page. We're getting comments from our Facebook and YouTube page, and I wanted to show this one. And we didn't say this. We usually my lawyer side usually comes out early on. I am also a licensed attorney. That everything that we say here, all of the doctors on here, this is our own personal opinion, and this is not medical advice. So you can't take us to the bank or the courts on this one. But we do encourage questions from viewers, and to the extent you all are comfortable, Dr. Wakefield and Dr. Celestin, could you speak to this question from a viewer? Do you recommend crowns versus pulling the tooth?
Yeah, I definitely can. And thanks for the question. We always recommend saving a tooth when possible. Nothing that works better in your mouth than your natural tooth. So when you take a tooth away, then what ends up happening is that form and function that I spoke to earlier becomes compromised. Teeth begin to shift from side to side, up and down, into those empty spaces, which can actually complicate the way that you chew your food and eat. So if you have a tooth that's in good condition, say it has a cavity, but it's not compromised in the area of the bone or what actually holds the tooth in place, then I would say fix the tooth with a crown or a filling. But if the tooth itself is moving, If the structures that actually support and hold the tooth in place are compromised due to gum disease, then that would be a situation where you would extract the tooth.
Yeah, so on the pet side, so absolutely, like Dr. Wakefield was saying, if we have compromised tooth in the sense that they the structure of the tooth itself is compromised due to disease, then that's a candidate that just needs to go better off, in my opinion. Now with pets, we're looking more at kind of a collective. You as the client, what are you willing to spend, because it can be costly? What are you willing to do as far as aftercare, because those things make a difference? What does your dog do? Does he work? Does he have an expected job or role in the family? Is a service dog? So all of those things play a factor when we talk about would we crown or would we extract. If you are a person who is like, I really don't want anything further, I don't want to have to do anything further than bringing it to you, and then we need to be able to get home and resume our life, then I would say root canal. Crown is really up to you, because for our non-working animals, a crown is really more of a protection of your investment in that sense. Now, if you have a dog that is going to go home and just rip up the next thing it finds with its mouth, then I would say, yeah, it probably should probably want to crown that tooth if you don't want to see us again for the same broken tooth. Now, that also comes with, we want to see that crowned and root canal tooth every 6 months to check it up and make sure that the health of that tooth is still viable. If you're okay with a little, what I like to call tough love, in the sense that that dog is not going to be chewing on anything for the next 2 weeks, you can keep it from mouth play. You can resist your urge to go in there and start peeking around at what's going on, because if we take a tooth out, it will have we'll have incision. There'll be an incision. There'll be sutures there, and you can get past that 2 weeks. And you're okay with that dog missing a tooth, because the reality is the dog does not care that the tooth is gone. He will get along dog or cat, I should say, will get along just fine. After you make it through those 2 weeks, a missing tooth is fine. And at the end of both of those options, we have our goal, which is a happy, healthy, comfortable mouth.
I have something I want to ask. So I think some people don't go, and one of the viewers actually asked this question about insurance. And I've had patients that I see who have poor dentition, and I'm like, oh, we need to go to the dentist, something's going on with your mouth, and they're like, I don't have dental insurance. So I've asked, I recommend that they go sometimes to clinics that are sliding scale clinics, so they can see someone. But from an insurance standpoint, I think that might be one reason why a lot of people don't go to the dentist, because they don't have dental insurance. But what other options are there on the human side? And then from a pet side, what are there options out there for dental insurance for pets?
Well, as far as on the human side, you're right. Access to care is an issue. It's not only about the insurance; it's about how available the dentist is in a particular person's area. Of course, the socioeconomic background plays a role in that as well. But they do have dental clinics, dental schools available that can offer discount, fees, I guess I should say, so that things can be taken care of. There are also government programs that have money set aside for children specifically. Again, sometimes the children get the benefits more so than the adults, because on some people's jobs, having dental insurance is a luxury item, and they don't always invest the same way in that regard as well. And they also have some other things online. If you go to your state and you look online, you may be able to type in, say, for example, Medicaid dentist or discount fee rates for dentists, and they have certain groups and associations where people can sign up for that. I myself am part of something called Donated Dental Services. And what that means is that there are people that can go to the website, Donated Dental Services, and apply to be seen here at no cost to them, because I have, I've given myself to the organization to be able to, help some people that are in need when the need comes up that can't otherwise receive treatment.
Yeah, on the pet side of things, there's definitely pet insurance out there. There's a whole bunch of them now. They've all sprung up over the last few weeks, and they're all great. my suggestion, just as a veterinarian, would be, as soon as you have an animal in your home, you need to sign up for that pet insurance, because it can definitely come in clutch. And you don't want to find yourself in a situation where they don't cover something because it's, now pre-existing, and those things. So it can certainly help. It does work a little differently than human insurance, in the sense that you're paying a monthly fee for the pet insurance, but when you take the pet in, if you want to use that insurance, you do have to pay up front, and then the insurance company will reimburse you after they've taken a look at what has been done and all of those things. A lot of offices and careers are definitely offering pet insurance as a part of your package. So definitely check into that to see if your job offers that now. There are also, when we talk about especially dentistry and animal care, there is, your primary care, who you go to for vaccines and things like that, may have a level of dental care that they are comfortable doing. And there are some things like jaw fractures, root canals, crowns, things like that are going to be more on the specialist level. So that will also up your cost of things, but definitely always start with your primary care and see where the things that they can get done that will help you as far as the financial aspect of it. And obviously, if it's something that they're not comfortable with, or that will need to be done by a specialist, that's something that, insurance could definitely come in on the underside and help you with.
And one thing you mentioned, Dr. Candace, about people being afraid, and I know I have a 4-year-old, and my oldest she's about it with the dentist. She loves it. She enjoys going and showing off her teeth and how well she's brushed. But my 4-year-old hates it. Like, she cries. And and what are some ways that you have learned to get people over that anxiety? And I also want to talk about your book. You've written a book that has been out for a little while, but it's something that I think needs to be revisited. So it's something that we could read to our kids at home. Can you tell us about that?
Yeah, sure. So I did write a book. It is called My Dentist Appointment, and it's a book about lessening a child's fears about going to the dentist. Again, as I mentioned before, they're afraid to go, and they're usually afraid because, not this is the case for you, but the parents have made them nervous about going because of the child's fears. Okay. So one thing that I've done is I recognize that fear. And so we meet that fear right where they are. And the first thing that we have to do as a pediatric dentist is connect with the child, getting down on their level, looking at them eye to eye, gaining that trust from them, telling the truth, not trying to hide, the syringe to get them numb. And we call it tell, show, do, which means you tell them what you're going to do, you show them what you're going to do, and then you do it. So it can't be this big mystery about what's going to happen when they go to the dentist. And so when I wrote the book, I kind of walked through all of those phases, from the child first coming into the building, kind of assessing the environment around them, seeing kids come and go, happy or sad, kind of making that assessment through the child's eyes, meeting the dental assistant or meeting the dentist. And the conversation in the book that I have with the child is just me actually just talking normal, even though the parent may sit in the corner wringing her hands, pacing the floor, can't wait to tell me about the pain that she's having. I could care less about that initially, and I just jump right in and talk to the child and connect with her about, PJ Masks or what shoes that she's wearing, or that I like her hair, or that I like his shoes, and then we make that bond. Of course, I have several jokes along the way to kind of make it easy for them, but it's about that kind of a connection, so they're not afraid. They're not, and also you see how you guys have on the white jackets. We wear a colored coat. Not that we're cooler or anything like that, but it's just because the children associate the white coats with something more negative in the hospital experience. And a lot of times kids do come with those preconceived notions and those fears about the jackets in the hospital. And we don't look like that. So it's just a matter of playing that game with them so they can become less afraid about going to the dentist. But you have to have that trust.
It's funny that you mentioned the white coat. I actually don't wear a white coat at work either, because dogs, believe it or not, have a white coat syndrome as well. They see it coming. and when I'm putting my hands in a dog's mouth, it's like, okay, well, we want you to be as comfortable as possible. You have to having to play that, get comfortable with the animal and also get comfortable with the client and owner. So Yeah. Can you show your book one more time, Dr. Wakefield?
Yes, please. Hold it up so everybody can see that.
That's me. That's my dentist appointment. It's
That's so
actually
awesome.
my niece Michaela. I made the book about her. She's the main
Oh.
character and her brother. But it talks about it. It shows me being playful on the back about not being afraid at the dentist. And you can find it on Amazon. I wanted to write a book that wasn't like, Dora and this and that, but to tell a real story. And basically, it ends very well where the child, nothing was really going on at all. They just had a new tooth coming in. And so they weren't afraid after that. But it's really about just not letting them be afraid, by telling them who you are, letting them see your face, even though right now during COVID it's difficult because we're covered up from head to toe with everything.
Mhm.
But the tone of voice, is the rate of your speech, is the atmosphere in the room. All of those things make a difference. General dentists, they do the best they can with what they have, but pediatric dentists kind of know that little secret about how to get the child to be comfortable, as well as the parent too.
Thank you so much for sharing your book. I just posted it on our YouTube channel to make sure everyone can see that. And please, we encourage everyone to take a look at that because there's a lot of fear surrounding going to the dentist, as you said. And Dr. Celestin, you may need to do one about pets. But we have a couple of questions. We're actually getting a lot of questions today from our viewers. And we wanted to show this question about human medicines and animal medicines being used interchangeably with pets. Are there any human medicines that are used for pets? And are the doses and treatments the same? We all probably can answer that one, but I'll let whoever wants to go first answer that.
So I'll take this as a good segue from the fear speech into this. So when we talk about our pets going in, and they usually can be a little fearful just going into the vet period, we do rely on pharmaceuticals a lot in our pets. So we have used, gabapentin is a human drug that we have found works very well for not only pain, but also as a sedative effect for our pets. So we use it a lot in cats. We may ask you to send it home. We may send it home with you as well, depending on how anxious our kitty is, and follow up with that. Trazodone, which I use for my pet to keep them calm, and it just makes it a lot easier for us to be able to handle them without, when it comes to restraint, sometimes less is more with pets. There are tons of human medications that get used. On the animal side, is particularly the anesthesia is a lot of those things are the same as well. And most of them, at least from the dental standpoint, are usually for calming and keeping them either calming or pain. And they all tend to work fairly well for us.
I was going to add on to that, Dr. Celestin. In veterinary medicine, we're pretty much required to do dosing calculations every single time. We have to always take the weight and do it to the T. I mean, and I know you can't always split a tablet or split a pill, but that's a requirement. Even though there are dosing ranges, we always have to calculate dosages based on the weight of the pet. So I think, and we can confirm this with our human colleagues, but it may be more so for pediatrics. There's probably more dosing, but we do a lot. We have to do a lot of dosing calculations down to the T because of the weight differences in pets.
And I will follow that up with that. While we do interchange our medications between human and veterinary medicine, I strongly encourage and urge people to not take what your veterinarian or physician has given you and use that and that only. Please do not try to self-medicate at home with what you have, because there can be some very serious consequences for that. So trust in what your physician or veterinarian has prescribed for you, and any questions, refer them to your physician or vet.
Our human colleagues, do you want to weigh in?
Oh,
Well,
so I mean, I think I've had some patients actually ask me, and gabapentin is something that I prescribe a lot for neuropathic pain for humans.
Mhm.
And so I have had people ask me, and I always say, you need to talk to your veterinarian because I know nothing
Absolutely.
about pets. I know about human
Absolutely.
bodies. So I
Hmm.
try to steer clear of that conversation quickly.
Yep.
And I know that for the pediatric side, you do have to do doses based on weight. But as far as patients using prescriptions that you've given for a kid for their pet, have you ever run into that?
well, my colleague just recently got bought a puppy, and he did share with me that he had to give Benadryl to the dog. So I assume he was correct. Correct in that. But outside of that, I have not ever come across that question. So that was a good question.
We could do a whole show on
Right.
pharmacy because it's really there are a lot of similarities, but a lot of
Hmm.
differences. We definitely use Benadryl. We have a lot of vaccine reactions and other type of allergic reactions. We administer Benadryl in the clinic, and we've had to prescribe it over the phone if we have a veterinary client patient relationship with that party. So yeah. Let's see. So what do we let's talk about a lot of people don't talk about oral cancers, tumors. Can we talk a little bit about that on the human and animal side?
Yeah, I can speak a little bit about that again. I'm a pediatric dentist, and so we don't see a lot of oral cancer as we would in someone that's older. But the end result is usually the same in terms of, I should say, the beginning, inflammation being the culprit in this. There has been, I think it's like 53,000 Americans a year that are diagnosed with oral cancer. And usually, when they are diagnosed with oral cancer, it's aggressive because it's diagnosed late. And as we mentioned before, they don't go to the dentist until something really happens. And it's sort of silent in the sense that it's a very slow growing. And sometimes when they find out, it could be stage 3 already. But those things do take place in the mouth, and we normally see that, and more so in adults with the really angry bright red lesions and gums and bright red gums. In terms of oral cancer, we're checking on the dorsal and the lateral surfaces of the tongue. It's good to go and get that. I don't know what month is oral cancer month, awareness month, but you can also tell if you stick your tongue out and we look on the side, the edges of the lateral border of the tongue, and we kind of can see a scalloped appearance there primarily is what we tend to look. And we can see that with instrumentation. They call it a vis light. It kind of stains the area blue. It'll show up blue in the mouth. And there's different other things that can be tested. There's also, what is that, HPV 16, oral cancer as a culprit. You've heard about the HPV vaccine. I recommend that children, teenagers, when they're approached with that from their physician, our recommendation is that they should get it because it would help a lot later on in life with the, help to decrease the numbers of how many Americans are diagnosed with oral cancer a year.
Sounds great.
Yeah,
So
we
have
see
you
tons
seen
of
oral
oral
cancer?
cancer,
Yeah.
tons of it, and it can run the gamut. So it doesn't necessarily have to be our geriatric patients. We see them in our younger patients as well, but there are more benign oral cancers. Some of them have to be dealt with more aggressively. So we do a lot of, sometimes it may just involve, if we catch things early and small enough, we just may have to deal with a small area. But we do have cases where we get these giant aggressive masses that involve having to remove parts of jaws, which believe sounds to the human mind is like, what? Absolutely not. But animals are incredibly resilient and stoic, and they get along just fine. In fact, recently we just had a very aggressive tongue tumor on a very tiny little chihuahua that we saw, and we took off half of her tongue, and within 2 weeks she's eating and thriving and doing great. So to that I say, like Dr. Wakefield was saying, if you see something, don't wait. wait on it. If you see something that doesn't look right in your animal's mouth, get to your veterinarian as soon as possible, because the smaller it is, the better chances we have of being able to deal with it, and giving them a more comfortable and longer time with you. So.
And there is a direct link between periodontal disease and head and neck cancers. And again, inflammation is usually always the result. Now, again, these are correlations. This is not causation. It's just an association. Again, it goes wherever the blood can go. This is where these things can show up. And so periodontal disease and prevention of periodontal disease and oral screenings and exams is definitely the way that we can prevent some of these things and identify them early.
I know that there's a big industry for different types of flossing, different types of toothbrushes, the ones that go to the side, ones that go around like this, and then you got the water picks. And so what are you supposed to, can we just be old school and just get a toothbrush and some floss, or should we, go out there and get all this other stuff? What is the actual recommendation that we need to do to get our teeth together? Besides going to see a dentist every 6 months, every day, what should we be doing? Animal or pet, human?
I was going to say, for the follow-up question for the pets would be, outside of what Dr. Kim is asking, what about chew toys and other things that people think that should be done in between time too? So go, Dr. Wakefield, you first.
Well, just to speak to the larger question of what we should be doing, the main thing is that you have to have good habits. It starts with your habits. So people like to always blame Candy. I take offense to that because that's my name, okay? So we don't want to blame Candy. But what we want to do is that you want to brush your child or yourself. You should be brushing 2 times a day at least, if not more. The recommendation is that it's after you eat something, not necessarily before you eat something. You don't want to constantly bathe your teeth in sweet solutions, sugar, soda, sweet tea, Gatorade, all of those types of drinks. They create acid. So when the bacteria is in your mouth and it mixes with the plaque, it makes an acid as well. So if you drink an acid and you already have acid forming in your mouth, then you get these holes, you get cavities. So the way you prevent that is by using a fluoridated toothpaste. Now, fluoride gets a bad rap by some people, but it actually is a naturally occurring mineral that exists in nature. It exists in some food, and it's like putting the wax on the car, okay? So if you leave your car out in the sun all the time and the paint starts to chip, that's what happens to your teeth if you're not remineralizing your teeth by brushing it twice a day with fluoridated toothpaste. Now, not just any old toothpaste. It needs to have that ADA seal on the back. And it's very hard for companies to get that ADA seal. So you want to make sure you look for the right kind of toothpaste so it has the proper amounts of fluoride in it. So that's twice a day. Healthy snacks, apples and cheese and things like that. Instead of fruit snacks, let's try real fruit instead of things like fruit snacks. In terms of the type of toothbrush that you should use, there's been debates about that. Some research has said that, it's better to have a power toothbrush versus a manual toothbrush. I've tried them all, and I can tell you I vacillate between both. I like a power toothbrush just because it's doing the work for me, and I can never brush as fast as that's spinning around. The key, though, is that you actually replace the toothbrush or the head on your toothbrush every 3 months. So if you try to comb your hair or brush your hair with a comb that's missing some of the teeth out of it, you're not going to have a very good hairstyle. So the same thing goes with your toothbrush. It needs to be a soft bristle brush, not medium, not hard. People buy those because of the old people that like to say that harder is better if it's scrubbing everything off the teeth. It's actually causing more damage to your gums. It can cause gingival recession and periodontal disease. So soft toothbrush, twice a day, fluoride, not with all of the sweet, sugary snacks and drinks, and make sure that you see your dentist regularly.
As far as the animal side goes, we really don't need all the gadgets and gizmos and all those things. And all the little snake oil potions that you see in pet stores and they try to sell you. Because the reality is, if all of those things worked like that, and we could just magically make our mouths beautiful and clean with a swig of a colored juice, it would be on the human side already, and we would have it. We wouldn't have to brush. We wouldn't have to go see our dentist. And B, and we know that is not the case. So with our pets, really all you need is either a small toothbrush, or really if you can get, in CVS they sell those packages of gauze pads that are about 4x4. You can wrap one of those around your finger and that works just as well. You don't really need the toothpaste for our pets unless you just love the idea of a poultry smelling toothpaste.
Beef flavor.
Yeah, which tuna. They come in all variety of all things.
Oh yeah.
But the pet toothpaste does not contain fluoride in it. There has been some thought and concern of fluoride exacerbating or causing kidney disease, especially in cats. And the problem is that our patients can't spit on command. So we stay away from the fluoride if at all possible. You may have a bit of a fluoride treatment when they come in for professional cleaning. We may do some foam or gel that we can rinse off ourselves. And we're protected, we know that they're not going to swallow it and things like that. But at home, you don't need that. And the earlier you start, the better. So if you have a puppy at home, a kitten, start just with your fingers, getting in there, playing around so that they get comfortable with the idea of having something in their mouth. And they're not looking at you at 8 years old like, whoa, personal space. So that by that time, they're comfortable with it. And the recommendation is daily. Daily brushing is excellent. If you can do it once a week for your pet, you're way ahead of the game. And it's really just that mechanical action of brushing that is doing the job for them. Chew toys are always good. However, there's a rule of thumb. It's legitimately a rule of thumb. If I can dig my nail into the toy and it makes a little indentation, it's probably safe for you to give as a chew toy. If I would not hit myself in the knee with it, or I can't make an indentation in it, I should probably stay away from that because things break teeth. Stay away from anything that is pretty much come off of another animal. So antlers, hooves, pizzle sticks, those things. If you think about what those things were designed to do, they're designed to be indestructible. They weren't designed to be chew toys. So
No.
unless you want, you think a broken tooth is cool, and your animal surely, I bet, does not think it would be cool, then we want to stay away from those things. Chewing definitely encourages the bacteria and the plaque and things to stay off of the teeth. That's the way animals' teeth are designed. They are designed to kind of make things go away from the tooth. But if we're not keeping up with that regular routine of brushing and whatnot, it will accumulate eventually. And regular annual dental care.
I like to add as a pediatric dentist that a lot of times we get the question is when is the appropriate age to take your child to the dentist? Mm-hmm. And over the years, somehow, it's been that you don't have to take your child to the dentist until they're 3 or 4 years old. And that's just not the case. No one waits until they're 3 or 4 years old to take their child to the pediatrician's office. He's back.
Where'd you go?
I don't know. No idea.
I was like, sorry.
So yeah, you don't wait until your child is 3 or 4 to take them to the pediatrician for the first time. As soon as your child has a tooth, this is when they should be going to the dentist, because having a cavity in your tooth is not about how old you are, but whether or not you have teeth in your mouth. So like she stated, the earlier you take them in, the better it is. And it's not just about looking for cavities. We're going over oral habits. Some kids suck their thumbs and have pacifiers. Some kids are born with teeth. Some kids have, the freedom underneath their tongue. Their tongue tied needs to be clipped, and they can't feed as a baby. So it's not just to take them to the dentist so that we can see them. It's like that well baby check. A lot of times the pediatrician misses those things early on. So it's very important to take them by age 1 or 6 months after the eruption of the first tooth.
Yeah. I'll throw in there. I also encourage everyone to go, when we get off of this video, to go into Google and Google what a normal dog and cat bite looks like. Post it on the wall somewhere, memorize it, so that if you don't already have a puppy or a young dog, or even an adolescent dog, so that you know where their teeth are supposed to go. And if you notice that my dog's teeth don't exactly look like that picture, next time that you're in with your veterinarian, ask them to take a look at that, because we also see malocclusions or bites that are in the wrong place with animals as well, and they can be traumatic and painful. And there's definitely things that we can do about that, whether it be pulling teeth or all the way up to orthodontics if need be. So,
wait, so you're saying there are braces for dogs and cats?
There are. Cats, not so much. Dogs, yes. Not in the traditional sense of
braces.
Of human braces, but yes, we can move teeth if need be. It can be a headache, to say the least. But with the right animal and client, it can be done.
Quick follow-up question. Does it matter if it's an overbite or underbite? Because just so everyone is clear what Dr. Celestin is talking about when she says check your pet's bite, that doesn't mean let them bite you on the hand.
Right, exactly.
Some people might be like, yeah, go ahead, let me look at your bite. No, not if they can leave teeth marks on your arm.
Positioning of teeth. Yes.
Is it how their teeth meet, or can you explain?
Yeah, certainly. So everyone has seen a bulldog before. And their teeth, they have what they would call in the human world an underbite. So the bottom jaw, row bottom teeth, if you take this, are in front of the top teeth, where they should be, and the top teeth should be in front of our underbite. So they're here. So those top teeth constantly, as this dog bites, are hitting on the inside of the front lower teeth, which can cause those teeth to become loose. They can fall out easier. They can cause trauma to the soft tissue that's behind those teeth, and it just hurts. Like, who wants to constantly bite themselves? That just doesn't sound pleasant. Or we can have young dogs that have a shorter lower jaw, and their top jaw is just way too far out, and now their canine teeth are sticking into the roof of their mouth, and that can cause what we call an interlock, where it prevents that bottom jaw from really growing any further, because it's stuck. Teeth are stuck in here. So those are the things that you would really want to be looking for. Now, in some animals, like the bulldog or anything, what we call the brachycephalics or the short nose breeds, we have deemed those normal occlusions or bites when they truly are not. Yes, that's the way they're going to come out. So in that sense, yes, they're normal, but we do want to be sure that we're checking that they are comfortable in that bite. So.
Okay, we're actually at the end of our time, but we've enjoyed this discussion so much that when we plan next season, Dr. Kim, we're going to have to talk about teeth again, because I have other questions. I have questions. Do you want to close us out, Dr. Kim, what we normally do?
Sure. So normally at the end of our show, and again, we are we're going to be taking a break for a few months with all the things that are going on in this country. We are going to evaluate, and we'll be back stronger and better. But at the end of each show, we kind of tie everything together. We talked today about oral health and how important it is for you as humans and your pet. It really shows what your oral care is doing is what your body's doing. And Dr. Candace mentioned one word over and over again was inflammation, and how inflammation can wreak havoc in our bodies, in our mouth, in our heart, in our from diabetes. All of those things are connected to that word. So we're going to kind of focus on that afterwards. We're going to post some things about inflammation, what inflammation really means, and what it means to your body. But other things that we do at the end of the show, all of us have on T-shirts. I don't know if everybody has on a T-shirt or not, but we kind of go around and talk about our T-shirts, talk about what that means to us, and then we just tie it up and get out of here. So, Dr. Candace, do you have a T-shirt on?
I do. It says, "Proud aunt of a Howard 2020 grad."
All right.
He graduated from Howard in 3 years, and he's studying right where he just finished taking an MCAT, is looking to be an orthopedic surgeon one day once he gets into medical school. So we wish him well. Go Mackenzie.
All right.
Nice.
Okay. Dr. Priscilla?
Am I next? Okay, so mine is it's lighthearted today. It says vintage 1980. I'm aging like a fine wine. So I'm just I turn another year, this year old this year, God willing, and 2020 is supposed to be the year. Everything's supposed to be so fabulous in 2020, and I was supposed to go to the U.S. Open in tennis and see Hamilton on Broadway, and then a whole pandemic happened. And a whole movement happened, and I can go on and on and on, of things that happened this year. But I really, I didn't expect to have this much introspection during this year, but it's been amazing, and I'm so thankful to God willing to see another year. I have a birthday in October, so I'm really, really thankful for that, and that's why I have my 1980, because 80s babies are the best.
They are.
Dr. Kim?
Oh, okay. So I have a t-shirt on that says, basically it says, be present. And it's a quote by one of my Peloton instructors, this woman named Allie Love. And my husband and I have been practicing stoicism. And it's a way of thinking about things where you look at things that could go wrong, and it makes you grateful for the things that have gone right. So especially with this year, you think about all the things that have gone wrong, right? But then you think about all the things that are going right in your life. You have your loved ones, you have your careers, we have each other. Dr. Priscilla and I have entered into this great new adventure. And so we're present. Being present in the moment is something that I think all of us need to do more and more. Because even though 2020, everybody was like, oh, it's the year of clear vision, 2020. Now it really is clear vision. We are seeing clearly now what things are like from a government standpoint, what things are like from a health standpoint, and where we are as a country. So I think being present is something, and I hate to be so serious, but it's something that I think is super important in these times, because we only have this moment. We're not promised tomorrow. We can look back and we can't replay the past. All we can do is be present in the now. So with that, we want you guys to post comments about this show. We will again be back in a couple of months. Like us on on Facebook and on Instagram, as well as Twitter, and subscribe to our channel on YouTube. So we are really glad that you all were able to be with us today. It's MD plus DBM, where we take human health, pet health, and focus on one health where we save the world. Thank you so much, guys.
Thank you all. Thank you so much for joining us, doctors. We appreciate it.
Thank you for having us.
Yes. Thank you.